to another welcome to another edition of the Super Spreader Seminar Series. Well, my name is Joseph Burfi, and I'm going to be your moderator for this section. Well, we start with the land acknowledgement, and we want to acknowledge the land the OMNI Network head office is located on York University. And so the university recognizes that many indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. And so York University acknowledges its presence on the traditional territory of many indigenous nations. Now, the Super Spreader Seminar Series, as we call it, encourages highly qualified personnel. And so we mean postdocs and graduate students to present their research and promote their ideas, to share their research experience and establish connections among the various branches of the network. And so it is a platform to spread scientific knowledge about One Health research framework and showcase research progress, and then allow people to chat about science. And so the seminar will be beneficial for knowledge transfer among OMNI and the emerging infectious disease modeling networks and collaborating scientific community. Now, for the speaker, we have Dr. Yang. And so I want to give a little bio about our speaker today. Now, Dr. Yang is a researcher with a multidisciplinary background in academia and industry in the fields of public health, health informatics, business management, IT, and computer engineering. She is currently a postdoc in the School of Public Health Sciences at the University of Waterloo. As an academic researcher, Rena has expertise in applying statistical and machine learning techniques and leveraging algorithms to solve real-world problems in public health and healthcare. She has led various multidisciplinary projects in digital health, data science, natural language processing, and health information management. Apart from her academic engagements, Rena possesses proficiency in managing business operations across various business units in industries, such as medical device, IT, e-commerce, power transmission, and service outsourcing. And so I want to present to you our speaker for today, Dr. Yang. And so thank you for joining us. I hope you have a great seminar. And so I hand over to Dr. Yang to share her screen and continue with the talk.
Thank you so much, Joseph, for the nice introduction. Let me just share my screen. Right. All right, so hope everyone can see my screen right now.
For sure, we can see.
All right, thank you. Yeah, thank you, Joseph. And thanks to the OMNI Network for this wonderful opportunity to share our research project at this series of talks. My name is Yang, go by Rena. Like Joseph introduced, I'm actually like a hybrid researcher with a background in multiple disciplinaries. So currently I'm a postdoc working at the University of Waterloo, a School of Public Health Sciences, working for Dr. Zahed Butt, who is the PI for this project that I'm going to present today. So our project is under theme 3. So without any further ado, let's jump right in. So here's the title of our research project, Digital Disease Surveillance for Emerging Infectious Diseases, an early warning system using the internet and social media data for COVID-19 forecasting in Canada. So in this talk, I'll just follow this outline as simple as possible. So we'll start with some background knowledge, the methods we used, our study results, and I'll spend quite some time to facilitate the discussions, and then with some final notes to conclude my talk. Emerging infectious disease, so they are infections that are newly appearing or increasing rapidly in incidence or geographic areas. So these diseases are a major public health concern as they have the potential to cause significant harm to individuals, communities, and global citizens. In recent years, we have seen the emergence of several emerging infectious diseases that have had a profound impact on public health, such as SARS, Ebola, and COVID-19 caused by SARS-CoV-2, this type of virus. And just so those are just a few examples of emerging infectious diseases. So like I said, so they have caused widespread illness, death, and economic disruption. So the threat posed by emerging infectious disease is multifaceted. So these diseases have the potential to spread rapidly across borders, causing significant disruptions to global economy and travel. Furthermore, emerging infectious diseases can place a significant strain on healthcare systems, making it much difficult for healthcare providers to provide effective care to those in need. As we continue to face the threat of emerging diseases, so it's crucial that we remain vigilant and take proactive measures to prevent and control these diseases. So this includes investing in research to better understand the biology of emerging infectious disease, developing effective diagnostic tools, and implementing measures to reduce the spread of these diseases. So during the past 3 years, over the COVID-19 pandemic, imagine waking up every morning and checking the news to see the latest numbers on COVID-19. You open up your computer and pull up the COVID-19 dashboard like this, for example, developed by Johns Hopkins University. So this graph pops up and your heart sinks as you see the staggering numbers. As of March 10th this year, so there are over 676 million confirmed cases of COVID-19 worldwide, and more than 6.8 million deaths. So these are not just numbers, they're real people, real families, and real communities impacted by this devastating pandemic. So we got to do something to control that, to better to predict that early. So as we all know, the emergence of endemics leads to increased media consumption by the public for health information. So people are increasingly turning to the internet and social media to share their thoughts, their views, and emotions related to emerging events or like emerging infectious diseases like COVID-19. So this has created rich information that can be analyzed to detect and track emerging diseases. So this data can be used to create a real-time surveillance system that could serve as an early warning system for emerging infectious disease. By monitoring internet search and social media activity in real time, public health authorities could detect emerging diseases as at an early stage and prepare accordingly. For example, if a sudden increase in search related to, for example, coughing, fever, and shortness of breath is detected in a particular geographic region, so this could indicate the emergence of a new infectious disease. The early warning system could immediately alert public health authorities, so they could take, proactive the initiatives, so target testing and treatment, implement, for example, quarantine measures, and take other approaches, take the appropriate steps to prevent the spread of the disease. So in fact, monitoring health-related search behavior and social media activity can enable early prediction of emerging diseases. A recent study found a strong correlation between internet search behavior related to COVID-19 and the incidence of COVID-19 cases. So that study showed the highest interest in relevant keywords on the internet and social media occurred 10 to 14 days before the peak of COVID-19 cases. So in terms of the potential of social media data in tracking public attention in real time, especially during the pandemic, Infravalence has shown us that by monitoring social media platforms, we can get a better understanding of how people are reacting to a particular issue. And during a pandemic, this can be particularly useful in predicting outbreaks. A real-time warning system can be created using social media data to identify pandemic-related signals and inform public health authorities in advance about outbreaks, hospitalization spikes, and testing needs. So all this can help public health officials to take necessary action ahead of time and minimize the spread of disease. However, we need to be aware that noise in this type of self-generated social media data can affect the accuracy of these models. Noise can arise from factors like misinformation, irrelevant content, and spam. And during the COVID-19 pandemic, there was a massive misinformation on social media platforms. So all this could potentially lead to panic among the general public. Research on the impact of noise on the accuracy of models using social media data is a very important step. So this can improve the effectiveness of digital disease methods for detecting and responding to disease outbreaks. By understanding how noise affects the accuracy of models, we can take steps to reduce noise levels in social media data and make the models more accurate. So the hypothesis behind our study is that online information can be used to detect early signals of the COVID-19 outbreak. With the rise of social media, utilizing online data sources for epidemiological surveillance has become increasingly popular. By doing so, we have the potential to detect and respond to public health threats in a timely manner. Our study focused on analyzing the temporal correlation between internet search behavior, Twitter activity, and the incidence of COVID-19 cases. By examining all these correlations, we aim to demonstrate the usefulness of online data, this type of data sources for epidemiological surveillance. Through our research, we hope to contribute to the ongoing efforts to detect and prevent the spread of emerging infectious diseases like COVID-19. So in particular, our study objectives are to evaluate association between Google Trends and Twitter data on COVID-19 cases in Canada, and to investigate if these sources can be used as early warning signals for COVID-19 forecasting. I wonder if there's any questions so far. All right, so let's just continue. In terms of the study methods, so we extracted information from Google Trends and Twitter from January 1st, 2020 to March 31st, 2020 in Canada. To reduce noise in the data, we identified expected symptom keywords from the literature and only extracted information related to those keywords. For Twitter, we retrieved original English tweets using symptoms-related keywords and hashtags using the Twitter from the Twitter API. To ensure that we only analyze data from Canada, we excluded tweets explicitly tagged with geolocations outside of Canada. and tweets without explicit geolocations were assumed to be in Canada. The epidemiological data was obtained from the COVID-19 Canada Open Data Working Group. To make the data comparable, we normalized tweet counts and COVID-19 case numbers to the same scale of between 0 and 100, and same as the Google Trends data. To further reduce noise, we employed several denoising methods, including fast Fourier transform, moving average, Savetsky-Golay, and Loess smoothing. So these methods were applied to both Google Trends and Twitter signals to remove white noise while preserving the underlying trend. Additionally, we applied adjacent averaging to both Google Trends and Twitter signals to further reduce noise and improve the accuracy of our data. Our goal was to create a accurate and reliable signal as much as possible that could be useful for predicting early signals of COVID-19 outbreaks. So after denoising, we conducted time lag cross correlations between denoised signals of Google Trends search keywords, Twitter signals, and new COVID-19 daily cases. To give you a little bit introduction of this cross correlation analysis, so it actually measures the similarity of two time series as a function of the lag of one relative to another. So the cross correlation function is a statistical technique, so that is used to measure how much two time series are similar or different. It helps identify whether there is a relationship between the two time series and how strong the relationship is. It represents a correlation between the observations of two time series separated by k, for example, k time units. So this method helped us determine the relationship between two signals and how it changes over time. It also helped us understand the association between online signals and the spread of COVID-19. So simply put, we have two sets of data, say the daily search volume of a certain keyword, let's say fever, and the incidence of COVID-19 cases. If there's a strong positive relationship between these two time series or the two variables, we would expect to see the search volume and the number of COVID-19 cases increase together. So that's the idea behind this cross-correlation function. Now I want to introduce a powerful machine learning algorithm used to forecast time series data. So perhaps it's quite well known for now. So it's named long short-term memory. So in short, LSTM neural networks. So LSTM is a deep learning algorithm that can learn long-term dependencies in time series data and make accurate predictions. In our study, we utilized TensorFlow and Keras in Python to implement a LSTM model to forecast COVID-19 daily cases. We explored different training approaches with a range of different features and past days data that we used for build the model. So the model consists of two LSTM layers, one dropout layer and two dense layers. The parameters of the model was trainable, and we compiled it with the Adam optimizer with a certain learning rate, a certain range of learning rates. We also applied random search and Bayesian optimization to fine-tune the model's hyperparameters automatically. By doing so, we identified the optimal set of hyperparameters that could achieve the best performance in forecasting COVID-19 daily cases. To evaluate the performance of our models, we used a mean squared error, or MSE, as the loss function. So that was one of the major loss functions we used. We also used the mean absolute error as well. By comparing the predicted values with the actual COVID-19 daily cases, we obtain the MSE value, which measures the difference between the predicted and the actual values. So the lower the MSE value, the better the performance of the model. So one thing to highlight, the LSTM models. So this type of model is able to learn from previous data, and its powerful prediction capability make it very useful and very powerful tool in forecasting future events. The use of deep learning-based algorithms like LSTM is essential in understanding complex phenomena like the COVID-19 pandemic. Now let's talk about some key results. So on the left-hand side, you see an example of signal processing using one Google Trends signal, fever, as one example. So the top left graph is the raw signal by days. So on the x-axis, you see from day 1 and up to day 90. So the first 3 months of the pandemic during the data collection period. And then the bottom left graph is how we're denoising while preserving the underlying trends of that raw data for the fever of the search keywords. So on your right-hand side, the top right graph is denoised Google Trends using during the first 3 months of the pandemic. And the bottom right is the denoising of tweet counts on COVID-19 symptoms. And here's the plot that we put together, all the Google Trends and Twitter signals together. So that kind of showing you in the under the same, let's say the same scale from 0 to 100. So you would get a sense of how those signals looks like after denoising. So using denoise data, the graphs on the left show the example of cross-correlation function. So on the top side is the between the Google Trends signal cough and the daily cases, and then the bottom is the cross-correlation function between Twitter signals and the COVID-19 cases. So the table on the right-hand side summarizes all the signals, so sorted by the maximum correlation coefficient. The time lag across correlation analysis showed a range of 1 to 13 days of time lag, meaning that searching these symptom-related keywords on Google Trends or tagging on Twitter happened 1 to 13 days earlier than the peak of COVID-19 cases. Except for one Google Trends signal fatigue, the rest signals had a maximum correlation coefficients greater than 0.5, showing fair to strong correlations with COVID-19 cases. So I think that everyone's kind of familiar with those signals or those keywords. So I like to highlight the 2 words here, anosmia and the dyspnea. So anosmia is the partial or full loss of smell, and dyspnea is the medical term for shortness of breath. So so this table summarizes our experiments on the LSTM models. So models 1 and 2, so we use the past 5 days of data. Models 3 and 4, we use past 10 days. And the last 2 models, 5 and 6, we use the last 15 days of data collected. And under each group, so the first model, for example, the model 1, so we use Google Trends signals only. And the next, so for example, model 2, so we use the combination of Google Trends and the Twitter signals to see, the differences between the model behaviors. So obviously, you can see that based on the loss function mean, for example, the mean squared error. So the model 2 achieve the best performance. So that means using both the Google Trends and the Twitter signals, using the past 5 days of data to do the forecasting, so that achieve the best model performance. So again, these graphs so illustrate the performance of LSTM models using, like I said, the combination of Google Trends and Twitter signals. So they trained from left to right, so trained with past 5, 10, and 15 days data. One observation from our experiments with different LSTM models is that as the number of past days increases, the mean squared error also increases. So that caused the predicted curve to fall back. Additionally, we also try to include daily cases as a predictor, but that becomes less effective as the number of past days increases. So like I said, the model performance was found to be optimal with minimal MSE values with using both Google Trends and the Twitter signals from the previous 5 days. So in this study, we aimed to investigate the relationship between internet search engine queries and social media data on COVID-19 and to develop a forecasting model for predicting COVID-19 cases using denoised signals from these sources. So this study found that Google Trends and Twitter data can be useful to forecast COVID-19 cases in Canada using a deep learning-based algorithm, LSTM, to forecast COVID-19 cases. In a nutshell, this study highlights the potential of digital disease surveillance as an early warning system for emerging infectious diseases. So the time-lagged cross-correlation analysis. So this type of analysis shows a strong correlation between COVID-19 symptom-related search terms and daily cases, with the maximum correlation coefficients greater than 0.7 for majority of the signals. And we did identify the range of time lags between 1 and 13 days apart. So for example, the Google Trends signal cough, we identified the maximum correlation between searching these terms and the COVID-19 cases. The maximum correlation coefficient was 0.825. So that was achieved at time t-9, meaning that searching the cough symptom, this specific symptom term, occurred 9 days earlier than the peak of COVID-19 cases. So similar trends were observed in Twitter data as well. So it shows that this type of data can act as early signals to create a real-time digital disease surveillance system. Our study has shown that combining these two data sources provides a more complete understanding of public perceptions and behaviors related to COVID-19, leading to improved predictive accuracy. So we're able to improve signal strength through signal processing, resulting in minimal mean squared error. Additionally, the time-lagged cross-correlation analysis helped identify the lag times between changes in search and tweet volumes and corresponding changes in COVID-19 cases. So that further improved the accuracy of our forecasting model. While we focused on Google Trends and Twitter data, further research could explore other data sources like other social media platforms and news articles to improve real-time surveillance system accuracy. In terms of the LSTM models, that's a powerful neural net model that can effectively model and forecast time series data, like in our study, the daily COVID-19 cases. It's true that LSTM models can face challenges when forecasting COVID-19 cases. For example, we have very limited data, especially in terms of the COVID-19 cases at the very beginning of the pandemic. And also there are other challenges like changing conditions. So all those things can affect the model accuracy. However, by carefully select and pre-process the data and tune the model hyperparameters, so we can achieve fair forecasting performance. So that would tailor it for early warning system. Social media platforms have emerged, so they act as a more valuable data sources nowadays for real-time surveillance, for example, for the emerging infectious disease. In addition to Google Trends and Twitter, platforms like Facebook and Reddit offer a wealth of information on the spread and impact of diseases and public perceptions and behaviors related to emerging infectious disease. For example, Facebook and Twitter data were used to track the spread of Ebola in West Africa and monitor public sentiment and behaviors related to the disease. Social media data from platforms like Reddit, so they were used to compare public attitudes about the COVID-19 pandemic. So this potential for real-time surveillance is significant, and further research could explore the use of other platforms to improve the accuracy of these systems. By tapping into social media data, public health authorities can monitor disease outbreaks in real time and take prompt and effective action to control the spread of the disease. While social media data and other digital data streams hold great potential for early warning systems, we must remain vigilant about the accuracy and reliability of the data. Bias and misinformation can lead to inaccuracies, and the representativeness of the sample may not reflect the entire population. It's essential to continue research to validate and optimize these methods, including developing more advanced machine learning methods and integrating multiple data sources. Through ongoing research, we can improve the accuracy and effectiveness of these systems and better predict the emerging infectious disease and protect public health. Some thoughts, some insights about the evaluating emerging infectious, the early warning signals for emerging infectious diseases. So this type of evaluation is critical for reducing the impact of outbreaks on individuals, communities, and our healthcare systems. So the evaluation metrics include the lead time between predicted and actual disease breaks, which ideally should provide enough time for effective intervention and control measures. However, there's a contradict here for the machine learning models or any type of models. So these models are designed to actually minimize the difference between predicted and true cases. For example, the mean squared error or mean absolute error. So those type of loss functions were actually trying to minimize the gap between the true cases and the predicted values. So that makes it challenging to train a model to actually increase the error. So one approach to address this challenge is to incorporate additional data sources or additional features, such as other social media platforms, like I mentioned, or maybe environmental data. Another approach is to use ensemble models to combine their predictions of multiple models to improve overall performance. So these strategies can help us develop more effective digital disease surveillance systems and ultimately save lives. In terms of the contributions to digital disease surveillance, With the use of this advanced signal processing techniques and state-of-the-art LSTM modeling, we're now able to analyze multiple data sources in real time to identify early warning signals of emerging infectious disease outbreaks. It's crucial for effective disease surveillance because it allows for prompt and effective action by public health authorities to control the spread of disease. By accurately predicting the spread of emerging infectious disease, we can implement measures to prevent further transmission of the disease and ultimately saving lives. The implications for public health are immense. The use of these advanced techniques and models enables more effective monitoring and response to emerging disease outbreaks, reducing their impact on individuals, communities, and healthcare systems. So together we can work toward a safer and healthier world. I'd like to talk about the importance of using a data-driven approach in digital disease surveillance, especially in the context of emerging infectious diseases like COVID-19. So one method that can be used is a data-driven approach that leverage NLP and machine learning techniques. In particular, it's important to consider a broad range of potential keywords related to, for example, COVID-19 and continually update them as new information becomes available. So this can help to ensure that our surveillance system remain relevant and up to date. Another important consideration is the use of ontology-based approach. So such approach can facilitate data integration and interoperability across different data sources and systems. Incorporating ontology-based symptom keywords can also improve the sensitivity and positive predictive value of a surveillance system, and therefore enhancing its overall effectiveness. It's important to note that a dynamic and adaptive approach is needed in this area. Collaboration with experts in the field can be critical to ensure that surveillance systems are continuously refined and updated based on new knowledge and insights. So as with any study, so there are limitations to the data sources that were used in our study. So for example, our study relied on data from Google Trends and Twitter. One limitation of the Google Trends data is that it only provides relative search volumes, which is normalized to a range of 0 to 100. I think that would be another topic if we could kind of like doing the reverse engineering and to get the real search volumes instead of this relative volumes. But anyways, that's one limitation for our current study. Additionally, the resolution of the data available for a longer time period is lower. So meaning that we're trying to collect more data after the first 3 months, and then it actually becomes quite challenging, and it wouldn't give us like the daily search volumes. Instead of it's kind of aggregated to weekly values. So that's another limitations. So in terms of the Twitter data, so this type of data are limited to English tweets. That's what we extracted using Twitter API. And also, like I mentioned, the geolocation data may not be entirely accurate or reliable. Another limitation is that the study didn't filter out misinformation from the Twitter data. It's essential to consider all these limitations when we interpret the study results to avoid drawing inaccurate conclusions. In disease surveillance, so retrospective time series analysis is commonly used method. However, this approach has its own limitations, so it's prone to overfitting and may not generalize well to new data. disease outbreak data is highly complex with many variables, while internet and social media surveillance data can provide valuable insights. It should be considered alongside other surveillance sources. It's also important to note that digital data sources may be subject to biases and may not capture the full picture of the outbreak. To ensure accurate and comprehensive disease surveillance and forecasting, a multifaceted approach that incorporates multiple data sources with multimodal disease models is necessary. So in conclusion, our study highlights the significant role of internet and social media data in early detection and forecasting of emerging infectious disease like COVID-19. While there are challenges in processing and analyzing self-generated data, continued research and innovation can address these issues. So leveraging these tools can help develop a more effective real-time digital disease surveillance system. It's also important to keep in mind that evaluation of an early warning system is an ongoing process that requires careful consideration of a range of factors. So on that final note, it concludes my talk for today. In closing, I want to express my gratitude for this wonderful opportunity to share our research with you today. I hope that the insights we've discussed today have provided valuable ideas and inspired you to think more deeply about the potential of digital disease surveillance. And of course, none of this would have been possible without the generous support of the OMNI network. So once again, a huge thank you to them for their continued commitment to advancing One Health modeling and research. Thank you all for listening.
Thank you, Rena, for such a wonderful talk.
Thanks,
Yeah,
Joseph.
so it's time for people to ask in their questions. So you could put your questions in the chat and I'll read them out loud for you so that Rena can react to them. Or you can unmute yourself and ask directly. We also prefer that, so if you can. Yeah, so. Okay, so there's one question here, Rena. I'll just read it.
Sure, thank you.
I'm just wondering whether you try to penalize Google and Twitter data, as they may also represent seasonal flu rather than COVID-19.
So if I get the question correctly, so that's about like incorporating the seasonal data, is that right?
Yeah, so.
Yeah, that's a great point. So in our research, so we actually collected, so in addition to what I presented right now, so at the beginning of the research, we did collect like different type of search terms other than the symptoms related terms, for example, like COVID-19 related terms, and then the public measure related terms. But we didn't consider about the seasonal because that could be another noise that bring to the analysis because at the beginning, like the first 3 months of the pandemic, so from the January to March 2020, so that 3 months, that could be like seasonal. So I was wondering if the question was related to, for example, the like the flu season, so that type of noise.
Yeah.
So yeah, so I was thinking that that could be, but for our analysis, we just take, you know, like I showed here, all the symptoms keywords. Let me just bring back to my slides. Yeah, so those are the signals actually we eventually focused. Yeah, but that's a very good point. Yeah, so that could bring to some additional noise in terms of the because like this type of infectious disease, they do share some common symptoms like the common flus, like cough, runny nose, sore throat, fever, that type of common symptoms. Yeah, that's a very good point. Thank you for asking.
Yeah, right. Okay, well, next, Sonas, you can unmute yourself and ask your question.
Thank you very much for your interesting talk. I have many
Thank you.
questions, but my main question is, I didn't understand the time here. As you said, we should have lower MSE value. It means loss function mean skewer should be less to have exactly. And by increasing the past days from 10 to 15, for example, the error increases abruptly. And I mean, your data is for 3 months from the beginning of January. And so you want to find a period of time. I don't understand the relationship between 3 months and the past 15 days, past 10 days.
Yeah, so this, all right. Okay, so I think I kind of get your question. That's right. So the total amount of data we used was from January 1st, 2020 and up to March 31st, 2020, exactly the 3 months. And then at the beginning we were trying to like split the data as like training and the testing, but because of the cases, so here like the blue curve that shows the actual COVID-19 cases. So it only appears so from the possibly from mid of March, so that's only the actual cases started to accumulate. So that's the data we have. So based on this type of limitations, so we couldn't really do the splitting, and we did try that, and the model performance was really like very shaky. So that's we took another approach. We used the number of past days. So meaning that we use here, so all the data we use as the trainings, and then we use the past 5 days, for example, from March let's say 15 to March 20th, so that we took that 5 days, and then we're trying to predict the March so March 16th. So that's the type of past days we used, and then we tried different number of past days, and then we did find that with the past days increasing, actually the error, the MSE value was actually increasing as well. So that's what I discussed. So for this type of machine learning models, so we aim to actually reduce the errors, right? We try to predict that as accurate as possible. So in that sense, we would like to align the orange curve exactly the same as the blue curve. So we were trying to make the actual and the predictive values the exact as possible. But however, from the early warning system perspective, we're actually trying to increase the gaps, right? So I was wondering if you get what I mean. So we're trying to increase the gaps. For example, if we take this past 15 days of the analysis, so that actually it indeed pick the trend for the first, I would say like more like the first wave or beginning of the first wave. So it did pick up the trend, and then it did give like sufficient time for public health authorities to do something over that 15 days. So in that sense, we actually had a quite discussion among our team ourselves. So we're trying to see from public health perspectives, so which model would you pick? Would you pick the last one, like for example, the past we use the past 15 days data to do the prediction, whether this model is more desirable versus the 5 days. The 5 days we did minimize the errors or the loss function actually we achieved the best performance in terms of the model itself. But from the utility of this type of model, so whether this is the best model or not. So I think we could have some good discussions on that. But thanks again for your question.
Thank you. But is it true to say that, I mean, roughly speaking, that after passing the training month, it is somehow 5 days, 10 days, and 15 days for different errors? And
right.
Is it somehow such as climate changing data that we cannot have long-term forecasting?
Yeah, that's a very good perspective. Like environmental change, so all this climate change. So like I mentioned in my talk, so I was hoping, if possible, we could do like multimodal approach to incorporate more data sources, like environmental data, into the models, and we would like to see like how true is this prediction. So this only reflect the COVID-19 cases where there's like climate change, that type of other factors that impact the predictions.
Thank you.
Yeah, thank you very much. Thank you very much for your question.
Thank you.
Okay, yeah, Pei, you can go ahead.
Okay, thank you, Rena, for the nice presentation.
Thank you.
And I really enjoyed it. So I just want to follow the, I guess, Sana's question. So for this picture here, right. You have 3 models with the, like, using the data with 5 past days and 10 and 15. So have you think of other numbers of the past days, and can we have this optimum time lag for the prediction?
Yeah, we did try from a past 1 day and up to past 15 days, because from the literature there, research about using using another social media platform data. So they identified the time lag between 10 and 14 days. So we haven't tried beyond the past 15 days, especially due to the limitation of this data we have. So we're trying to identify the early signals. So we cut off the data collection period to March 31st. So we only took the first 3 months of the data for this analysis. So in terms of the less less value of past days, like the past 1 days, actually the performance was quite similar as what we were showing here. So we decided to just present the past 5, 10, and 15 days, and that also aligns with the existing research. I hope I kind of answered your question, Pei.
Yeah, I think yes, but like you said, you may want to like leverage for the performance of the prediction, and also consider for the public health, like they want to know or detect the outbreak much earlier than the real one. So actually, maybe for the 15 one, they may prefer for that. They have more time to prepare for the pandemic. And I guess we consider these 2 aspects and to find the optimum, the time window, I guess.
Right. So we're trying to leverage both the modeling performance in terms of like this type of predictive models, and also the utility of these models. So trying to leverage that. But I think that would be a very interesting discussion point. And I hope the audience here, if anyone have seen or have ever come across any literature, so I would be happy to hear your thoughts. Yeah, thank you so much.
Okay, thank you. We have a couple of questions in the chat. So before I come to you, Mohammed, I would read a couple of questions here. So Mani wants to know whether your work is already published, Rena?
Oh, that's a good question. So we do have a short paper based on this study, and that is so we'll be presenting it at the MIE, Medical Informatics for Europe, so MIE 2023 in Sweden next. I mean, not next, the following week. So we did have a short paper based on this study. So that will be published on their proceedings, and we are working on the full paper. So yeah, well, we're trying to get that published soon. Yeah, thank you.
Okay, right. So the next question is, can the source data distinguish one infection from another, as some EIDIs have similar symptoms?
Sorry, Joseph. So I was reading the chat here. So which question?
So the question, this is from Jean Jacques. So he says that as some EIDs have similar symptoms, can the source data distinguish one infection from another?
Right. So our thought was to use individual signals or individual search terms, and then to see the predictive power for the COVID-19 cases. We also try to combine the signals, but that would be in the next step. So in terms of your question, can the source data distinguish one infection from another? That's a great point, but I would think, at least for our model, it's not reached that capacity to really distinguish one infection from another, especially like this type of infectious diseases. So they actually share the same origin of the virus. So it's really difficult to distinguish, especially just relying on the social media and the internet search data. But with collaborating with other, for example, environmental data, or maybe like wastewater, that type of data. So I think that may be possible in the future research. Yeah, thanks, Jean, for the question.
Right. Okay, so the next question is from Rigza.
Right.
Yeah, thank you for the nice presentation. I did not get how many steps into the future your model predicts.
I'd like to clarify. So what do you mean by like how many steps? So do you mean like the future work? Or how many steps?
Yeah, Rigza, if you could clarify that point for us. So before he comes up, I would.
So hello.
Hi,
thank you for your nice presentation.
Thank you.
You use five steps into the past to predict like tomorrow or like next
right,
week.
Like predict the next day case. And that's actually like the rolling base. So that's why we did come up with this curve.
Have you tried to further predict into the future, like next 7 days, something like that?
So that's actually in our continuous research. So we're trying to do the continuous or the rolling forecasting. So that will forecast like beyond the data collected here. That's in our agenda. Thank you.
Okay.
Thank you.
Mohammed, can you unmute yourself and go ahead with your question?
Yeah, thank you for that nice presentation. I'm just wondering whether did you try to fit the data or the model with the RCU data or DITS data? I think that would be much more informative in terms of the seriousness of the situation. Yeah, but then there is the problem of, I mean, for instance, here in Sweden, DITS are now reported on a weekly basis. So that could also make, I mean, a challenge in terms of data frequency.
Yeah, absolutely. So that would be, like I mentioned, one data limitations. So also for this type of modeling technique, so we need to do the continuous. So this is more like a static type of modeling technique. So we need to do, for example, the rolling forecasting. That's one type of methods, and also considering the keywords or the signals actually. So this is at the beginning of the pandemic. So we identified, let's say, those type of signals are really strong indicators to the COVID-19 cases. But right now, we're even like 1 year after. So those signals actually has been changing from time to time. So I would suggest for the future research. So this could be like a more dynamic modeling. So incorporate any available new information with new knowledge about the search peaks. And I know there's some other surveillance systems. So they did capture the like the search volumes, and they did have like a pool, or like more like a pool of the very wide range of search terms. So they could easily identify the sudden peaks of some terms, or maybe some new terms coming in. So I think that's dynamic modeling approach would be really desirable for this type of early warning systems for the emerging diseases.
Right. So now will be our last person. We're running out of time now. Okay, go ahead, Sunas.
Thank you. I have only a quick question. How about your word choices? Most of your words are based on the symptoms, but are you going to answer how people are involved with the COVID-related things? Isn't it better to have some words based on people's behavior rather than the symptoms? Probably we might have wrong understandings of our symptoms, you know?
Yeah, yeah, absolutely. That's a very valid point. So like I mentioned, so beyond this symptoms keywords, so we did have 3 other themes of the search terms. For example, COVID related. So in the beginning, they are like some, I don't know whether that's misinformation, but anyways, there are some terms they say like Wuhan virus or China virus, that type of terms. We did incorporate that into the like our study, and also the public health measures. So like mask, like social distancing. Actually, we did find those type of search terms were much stronger, even stronger than this type of symptoms related keywords. However, for the study, we kind of to say that more focused on the symptoms related keywords, because those other keywords, although they are indicative, but we still feel like so we should be really focused on the symptoms related. So that's health information that people are searching for this type of emerging diseases, and also using the symptoms focused or symptoms related keywords. We're trying to actually to do the this type of exercise or this type of modeling. So not only detect or predict COVID-19, so we're trying to find like any similar emerging infectious diseases, like more like airborne type of diseases. So we're trying to capture more like spectrum, the wide spectrum of their disease. So that's the idea. But yeah, very good points. Thank you.
Thank you. Thank you very much.
Thank you.
Okay, thank you, Rena, for the interesting talk. We appreciate your coming to present. And thank you, everyone, for joining in today. And we hope to see you in our next seminar. Okay.
Thanks, everyone.
Thank you, Rena. Bye.